All right, so we know on Thursday it's going to be a pretty big day, as we know that the FDA is going to meet. They're going to be talking about the next steps that need to be taken before any changes on COVID vaccinations for children 11 and under can be approved.
Right. Remember that we need to do those clinical trials in kids under age 12, both Moderna and Pfizer. And the good news is that Stony Brook is one of the few clinical sites around the country that will be doing the Pfizer under age 12. We're starting tomorrow, and the entire 6,000 kids over those sites will be enrolled in a week and a half. So we hope that we will see lots of kids enrolling on the study, and we hope that in the next 3 to 4 months, we'll have an answer. Remember, it's 2 doses, 1 month apart, 2 months of safety before the data can go to the FDA.
Now, what will you be looking for as you do this clinical trial?
A lot of things. We're going to be looking for early side effects. What's the pain in the arm? Is there any fever? We will also be looking for those events of myocarditis. As you know, there's been a lot of talk about, do any of these vaccines cause any heart inflammation or myocarditis? There was a case report that looked at quite a few, or not so many rather, just a few young men who a few days after vaccine perhaps had some inflammation. The good news is they all did well, and they got Advil to make them better. So that will be yet another toxicity. We're also going to look at, besides the side effects, we're going to be looking at how protective the vaccine is. Did the kids make antibody? So they will have a blood draw before and a blood draw after dose 2. The exact same things that we looked for in the adult studies.
Now, will there be a daily swabbing or anything like that, or no?
There will not be a daily swabbing unless the kid is sick. If the child is sick, there will absolutely be daily swabbing, and we're going to look to investigate among the family, is anyone else sick as well? But for the study, we'll swab them before and at each visit that they come in.
Okay, so this is talking about Pfizer. So let's switch over to Moderna, the other mRNA vaccine. We know that, this morning they actually announced they're submitting for authorizations for adolescents in Canada. We know they're also going to be doing that in Europe, and you're also going to be a part of the study that's happening here in America.
Correct. The Moderna study for children under age 12 is hoping to start for that large phase 3 in late July, early August. And Stony Brook, as a clinical site, will also be enrolling children at that time. And their timeline is exactly the same as Pfizer. 2 doses, 1 month apart, 2 months of safety, and the data will go to the FDA. That means that by December, we will have information for both vaccines in the under 12-year-olds. And that's great because we want it before we go into flu season.
Now, what about the dosing on it for our kids?
And each company is deciding exactly what dose they're going to want for the younger kids. Is it going to be the same dose as the adults, or is it going to be a different dose? Well, why would it be a different dose? And the answer is because kids actually have a better immune system than adults. And it may be that they may need less. Each company has to decide what's the dose it's going to use and then present that data to the FDA justifying the dose. And we will see how those studies go.